This is a plain CT scan of a 29 years old female patient. The patient previously had some surgical uterine intervention which she was not ready to disclose. There is mild hydroureteronephrosis on both the sides. Lot of inflammation in the lower part of mesentery. Now, please observe that uterus is enlarged and slightly hyperdense areas are noted in the uterus. These one here. These represent hemorrhage. This one here. Cystic lesions are noted in the pelvis. Now, patient has presented with severe pain in lower abdomen, high-grade fever, and leukocytosis. Contrast and CT scan. There is mild hydronephrosis on both the sides. Excretion of contrast medium is delayed. Lot of inflammation in the mesentery. Sub-centimeter sized lymph nodes in mesentery like this one here. No signs of intestinal obstruction. Uterus is enlarged. Now these are thin-walled cystic lesions in the pelvis. These lie in the pouch of Douglas and extend upwards along both the posterolateral sides of uterus. These are interconnected. These represent abscesses. Now this extends upwards on left side. When I scroll it down, it extends into the pouch of Douglas and it is connected with this collection here on right side. So the patient has developed an abscess in the pouch of Douglas extending along both the posterolateral surfaces of the uterus. This is the sagittal scan. Abscess. This part of the lower part of body of uterus and cervix, these are displaced anteriorly. Hyperdense material, blood clots in the uterine cavity. There is another thin-walled collection here, this one, showing thin marginal enhancement along the anterior surface of the upper part of the uterus. This collection, this is also an abscess here. This is the second collection. This is a delayed scan, bilateral mild hydroureteronephrosis because of the ureteral involvement by the inflammatory process. Sub-centimeter sized lymph nodes along aorta, in inter-aortocaval region as well. Lot of inflammation in the lower part of mesentery. However, there is no intestinal obstruction and the orally administered contrast medium is passing normally. This one collection here, abscess formation, another larger abscess in the pouch of Douglas extending bilaterally along the posterolateral surface of the urinary bladder.